Hello friends, are you suffering from any disease and you want to know more about it but you are not able to find any information because you are not able to talk to your physician or your doctor because of busy schedule and you have to stand in long queues or sometimes that your physician or doctor is not available, or you can say because of time constraint he or she cannot give you proper time. Hello, I am Dr. R.K. Dua and I am a surgeon, and I have started this series Know Your Diseases and Remain Comfortable. So in this I will discuss about various medical problems that the patients are suffering from. Number 1 is diabetes mellitus, hypertension, cardiac problems, thyroid problems, hernia, appendix, and many other surgical problems. So, in this series, I will first start with diabetes mellitus. So, one thing before starting any problem, I want to say that our human body is just like a system of, you can say, logistic system. So, as long as our logistic system remain healthy, working properly, our body is healthy. So it is our duty to maintain that logistic problem so that we have proper diet, proper exercise, and other excretory functions are working in a good manner. So how I am relating this to logistic? As you know, if you are constructing something, house or some building, and there are many things associated with it, from manufacturing to transport to the actual construction of the building or the dam. So if there is anywhere there is blockage of the system, suppose in between the truck that is carrying the cement breaks down, so what will happen? The construction activity will be hampered. If you have heard that during the COVID time, because of lockdowns, silicon chip was not being manufactured, and Taiwan is the main source of silicon chip for the 60% of the world population. So, because of that shortage of silicon chip, all the electronic industry, car industry were in bad shape because of shortage. So, similarly, in our body, in case of diabetes, so as you know, our vascular system, that is our arteries and veins, these are responsible for transporting all the materials in the body that is required by each and every cell. So these blood vessels and capillaries, these supply the nutrients, these supply the various hormones secreted from one place, secreted at one place and reaches to the other place. So when we eat something, that may be protein, minerals, anything that we eat from the intestine, it reaches to the circulatory system, that is the vascular system, and then it reaches to each and every cell. So what exactly happens in the diabetes? As you know, this diabetes actually affects our vascular system, cardiac system, our nervous system, and when these two systems are involved, then indirectly it can affect your heart, it can affect your liver, it can affect your kidneys, it can affect your eyesight. You must be knowing why and how. Why? Because when it affects your vascular system, that means supply to all these organs is hampered. So that's why the functioning of the eye, functioning of the liver, kidneys, spleen, so all these organs are directly or indirectly affected by the diabetes. Second thing I have told you, it affects the nervous system. So how it affects the nervous system? By, you can say, decreasing the sensitivity of the nerves by destroying the peripheral nerves. So our touch sensation and pressure sensation is lost. So though the pain is not a good sensation when we feel it, but the pain is the most important sensation for our protection. Even the slightest itching or slightest pricking of the pain alerts us that something is being, or some noxious agent is injuring our body, and we immediately try to remove that sensation of pinprick or mosquito or whatever it may be. So when these two system, vascular system and the cardio or nervous system is affected, so, and plus diabetes itself is a disease in which we have raised level or high level of blood sugar in circulation, that actually is not required by the body. So as such, diabetes affects whole of the body. So it affects our vascular system, it affects our nervous system, it decreases our immunity to fight with the diseases. So what happens in diabetes? The patient with diabetes first develop small vascular diseases, small neurological, you can say, small nerves or thin nerves in the peripheries are affected. So what will happen? Touch sensation and pain sensation is lost. Plus the nutrient to the skin surface is also very feeble. Oxygen supply is very feeble because of the involvement of the small capillaries, the small blood vessels. So that means the two things that is required for the repair of any injured part of the body, that is your nutrients, oxygen, and your pain sensation to protect the body against the any injuring agent. So when these three things work together, they cause severe injury to the body as compared to the person who is non-diabetic. Suppose you are, or you can say any patient with long standing diabetes and uncontrolled diabetes, what will happen? Vascular system is affected, small vessels are blocked or partially blocked. Peripheral nerves are also involved, neuropathy, high blood sugar is there, decreased immunity is there. So whenever you get some injury over the feet, over the any part of the body, what will happen? This healing process is very much slowed down because of the diabetes. Because the oxygen is required for the healing process is not reaching in sufficient quantity at the injured part. Number one. Number two, all the nutrients like proteins, minerals, vitamins which are required for the healing process, and various immune cells which are required for the healing process, because of the compromised vascular system, vascular supply to that area, these will not be reaching to that area. Plus, nervous system is also affected. So we will have less pain sensation or maybe no pain sensation. So when we get some injury over the feet or the hand, because there is no pain, we will not pay any attention to that, and it will be infected with dust and dirt. Because in the feet we do not know that we have got some injury in the feet, so that will become or go unnoticed. In that case, once the infection occurs, as I have already told you, first was the healing process was hampered. Now that wound was not healing properly. There was a delayed healing of the wound. Over that, the nutritions are not reaching, and that is also causing the delayed wound healing. And now the infection has also taken place. To control the infection from spreading at the site of entry, there are various cellular elements, immune cells, which are required at the site of entry of the infection. So these cells, these immune bodies will not reach in sufficient quantity at the site of injury. Over that nutrition is not there, over that oxygen is not there. So all these factors play in, and what happens? Patient will have severe kind of infection, and ultimately that infection will spread very rapidly as compared to the non-diabetic patient. So it becomes very essential for all the diabetic patient to pay attention to their even minor injuries. That is the main reason that you should not neglect any minor injury if you are a diabetic. You should always clean the wound immediately, wrap it with a clean dressing, and search for medical advice. If your blood sugar level is high, try to control as soon as possible. Because as the infection sets in, the blood sugar level is very difficult to control. And then the vicious cycle starts. Infection will cause further rise in the blood sugar. Further rise in the blood sugar will increase the chances of infection spread, decreasing the immunity. So both are in, you can say, working together. So in this case you have to control the one thing. If you control the infection by cleaning the wound, removing the pus, or debriding the dead tissue, so that will control the infection, and automatically the blood sugar level will also fall down. So you must not forget to take proper treatment for the diabetes, proper treatment for the infection. So you should not forget also to subscribe my channel to know more things about your diseases and how to take care of the disease and how these diseases spread in your body and what are the various precautionary measures that you can take. Thank you very much.